Good morning, everybody. Welcome on this fine Thursday morning. Slightly cold, but we're about to warm up with our presentation and Q&A this morning. I'm very, very excited to welcome one of our parents. Hello, we have Dr. Changgyo Yoon. Welcome, Dr. Yoon. Welcome to the college.
Thank you, Mr. Johnson, and for having me today and to speak to my dear Dulwich College students, which I have my two kids. I'm Ray and Lucy Yoon's father. So I'm very happy to be here with Mr. Johnson and to share some of my experience as a WHO staff working in the South Pacific.
Thank you so much. You're very welcome. I'd like to give you a brief introduction, Dr. Yoon, for our audience. So, Dr. Yoon is currently a Program Management Officer at the World Health Organization, or the WHO. So he's a public health specialist. He joined the World Health Organization back in 2015 as a technical officer for integrated health services. And since 2021, he has worked in the WHO's regional office at the Western Pacific as a program management officer for the Disease Control Division. And in 2014, he received an official commendation from the Republic of Korea's Minister of Health and Welfare for his contribution towards the tuberculosis control program. Dr. Yoon graduated from Chung-Ang University School of Medicine and holds a master's degree in public health from Seoul National University School of Public Health. Now, Dr. Yoon has worked in some incredible places, and you'll see some of the sites and the places that he's worked in today, this morning. For his first assignment after joining the WHO, he was sent to Fiji, which is extraordinary. A hub for the many island nations that dot the South Pacific, where he observed the various health risks that climate change posed to these vulnerable communities. And in his talk this morning, Dr. Yoon will speak about his experiences grappling with public health challenges in the South Pacific, while painting a detailed global picture of climate change-related public health issues that you've witnessed firsthand. So Dr. Yoon, over to you. Thank you very much.
Thank you, Mr. Johnson. So thank you for a very nice introduction about me. So I think I can start with my presentation to give you some impressive photos and videos, and then I will continue with Mr. Johnson on the Q&A and to have more interactive session. Yeah, so I was thinking about the title of my presentation. So because I'm still working with my organization, so I think this is a kind of interim report about my journey on the global health. So global health is a part of public health, which is to support other countries, mostly developing countries. So I want to give my focus on my experience from the South Pacific Islands. So indeed, I and Lucy Ray have lived in Fiji for 4 years, since 2016 to 2021, so quite a long time. And I just want to give you a question first. And what do you think about South Pacific? I assume that some of you have already traveled to South Pacific, or you from one of the South Pacific island country. But when we hear about the South Pacific, and we usually think about nice beach and beautiful shore, the nice island, something like this one. So, but there is a great risk of climate change and posed to people in the South Pacific. So not only South Pacific for the global society, but Fiji also was our second home for 5 years. So I really appreciate that we have great happiness and then great relationship with the Fijian people, which are very lovely and smiling people. So I want to give you a little bit more stories about how we lived, how I observed climate change and other public health issues in South Pacific. So I don't know how many of you have heard about the Fiji, but Fiji is a really well-known country for its tourism because it has nice beach, the islands, and many people traveling to enjoy their holiday in Fiji. And also people are really welcoming other people and smiling to other people. But Fiji is at a great risk or front line of the climate change because Fiji has 330 islands and many of islands inhabited, and those islands are really low-lying, compared with Korea. Korea has so many mountains, but Fiji is like a low-lying, islands. So many of people living very close to the ocean. So this is a photo that I took from the internet actually. So many photos I included in my presentation are mine, but I just got it from Fijian media. So this photo was taken just after a cyclone Winston, which was a grade 5. Grade 5 is the highest grade in the tropical cyclone classification. So a very deadly, cyclone which killed more than 40 people only in Fiji. So just after that, and then many villages around Fijian islands were flooded just like this. So we understand that this is also an impact of the climate change because when we go with this climate change, we'll be experiencing more extreme weather events like a tropical cyclone, snowing, and the rainfalls, as well as sea level rise, sea sprays. So I'm going to give you a little more explanation about that. So actually, as a WHO staff, one of my main job was to support communities. So I'm a medical doctor, but I have more specialty on the public health and the preventive medicine. Preventive medicine means we do activities and to prevent communicable diseases, non-communicable diseases, also support supplies and human resources to hospitals, health centers, etc. So my first job was to support very basic infrastructure of public health center in Fiji. So this person is a public health nurse, Fijian nurse, and this person is a community health worker, and who doesn't have any license on nursing or medicine, but he works for his own community. So he's been working as a community health worker more than 20 years. So I've seen very high commitment from Fijian community to their own communities to address health issues, climate change issues, and they want to do something to help other people. And I also work with these community health workers and who are from the very rural side. So they came to WHO office and to discuss how we can improve the health systems in Fiji. So it was my first main job in 2016 to 2017. Another country, because I have traveled many countries in South Pacific, so I want to also introduce another country to you, Kiribati. So Kiribati is not a famous country actually, so many of you may not have heard of this country. Actually, this is a very small country in the South Pacific, located around equator. So it has only 100,000 people, and their economic development is very low. So many people have a very basic level of the households and living environment. So you see from the size and appearance of this kind of islands, and we call it atoll islands. Atoll means it made of coral. So it was developed back in 100,000 years ago, and with coral. And coral made up this very unique appearance of islands. So in these kind of islands, you cannot find any mountain and anything. It's really flat. So there are people living in these kind of islands. So they are suffering from infectious diseases and non-communicable disease. Non-communicable disease is something that you have impact to your body, like hypertension, diabetes, and etc. So when I work with Kiribati, and I've seen there's a serious problem with their drinking water, because many people rely on well to get their drinking water. So, but the water from the well is really severely contaminated. So they cannot drink it. So after they get it, and they have to boil it, or they have to put it on the roof and to disinfect. So this is a facility to clean water, and it is a public health center in Kiribati, and she is a public health nurse. And as you look, it has a very basic facility. It's not like a hospital and public health center here in Korea. So they needed a lot of support from WHO. So I work with this country. Because I said, there's a huge problem with their drinking water. So what I've done is I met community leaders and to discuss about how to distribute this kind of, the water tank, because they have to keep their water tanks just next to their house to collect the rainwater. They rely on rainwater. So I don't think you have, imagine yourself getting water from, rooftop, because you have to, because you have a very clean water from the tap, right? So you can get drinking water from bottle or, the water tap, whenever you need. So, but there are people, so many people, relying on this kind of rainwater for their drinking purpose. So it happens not only in South Pacific. When you go to Africa, and there are many children getting water, drinking water from the river, and they travel more than 1 hour. So they carry the huge drinking water bottle or some kind of container from their house to the river, only to get drinking water or household water. So it's very different setting. And I also want to introduce Tuvalu, which is a very, very interesting country. So I have served as a Tuvalu country liaison officer. Liaison officer means I communicate very frequently with the government as a WHO staff. So Tuvalu has only 11,000 people. So can you imagine a country with 11,000 people? So it's a country. It's also part of the Commonwealth nations. So it has a prime minister, it has ministers, and it has teachers and physicians, everything. But the size is small. So actually Tuvalu is very famous for their address on climate change at a global UN General Assembly or other global meetings. So this is also a kind of global icon about climate change. So the Tuvalu has 9 islands, and the capital is in Funafti. I'm going to show you a very interesting video which I took with my drone. So and actually I'm an amateur drone pilot, so I want to show you this one. So you may find that the beach and everything looks very nice, But there are so many problems with this island. Not only drinking water, and there has status, and there's no mountain. You can see that there's no mountain. So this is very flat, and there's no big space for exercise. Actually, people use airstrip or airfield for their daily exercise, which is very interesting. So this is the air view on Funauti, the capital of Tuvalu. So the next two videos are about the Director General of WHO, so Dr. Tedros Ghebreyesus. So actually I have served him when he visited Tuvalu back in 2019. So I will show you a very quick video about how he addressed some issues in Tuvalu. So this is the airstrip that I mentioned, and that Tuvaluans use for their airstrip. So the person in the middle is a Director General of WHO. So he works with he's on morning exercise with the Minister of Tuvalu. So this is actually airstrip. So runway. So people come to this runway and every morning and for their daily exercise. So which is a very interesting, but it cannot happen in Korea because of aviation rule. So but they use it for daily activity. This is a video that Director General of WHO met a person working for the recycling, garbage recycling. So she's talking about how they manage recycling in Tuvalu. Actually, it's not perfect or it's not effective because the recycling facility was on hold. It was out of order. So she was talking about how they use the facility, and you see that they are on the shore, and just the behind of them it's ocean. So it's a very tiny and narrow island. So it looks like a banana on the ocean. So this is the situation in Tuvalu. So everybody lives on this kind of flat island, and then they are their house can be impacted by the sea spray or the sea level rise. So there's no way to go out from the island. And interesting is, 1/3 of the island is a landfill. So they manage all garbage and to put under the ground. So it also reduces the size of lands they can live. So some photos I took to present to you. So this is the landfill. So this is a Director General of WHO. So he points out some garbages unmanaged on the island. And actually this is part of the island, the main island. So there's only one way. So Tuvalu doesn't have address, postal address. They don't have it because everybody knows where to go to find someone. So it's like a very small village in Korea. So having 11,000 people. So this is only the way to get to the other side of the island. So if a wave impacts this part, and nobody can go out from this part to the other part. So one of my job was to support the government and to control dengue. So dengue is not a popular, it's not a well-known disease in Korea because, dengue is not endemic in here, but, dengue is really endemic in South Pacific and Southeast Asia. So, spread it by the mosquito. So they were controlling dengue and by, some gas, and then they are working on identification of mosquitoes here. I want to finish my presentation with a very famous saying that save Tuvalu is save the world. Actually, Tuvalu has been claiming that their country is a Canaria. So, do you know the meaning of Canaria? Canaria is a bird, but miners bring Canaria when they go into the mine. So, because Canaria is a very sensitive to the oxygen. So, Canaria senses oxygen is very low, and they cry, and then miners can go out from the cave. So Tuvalu thinks that Tuvalu can be a Canaria against climate change. So if the world can save Canaria, Tuvalu can save world. So that's why they have this saying. So it's been very, very famous after the Prime Minister of Tuvalu used this phrase. Actually, this is Ray, and this is Lucy. So I'd like to put climate change issue as a generation issue. So, I'm a middle-aged person, and I think many of teachers are middle-aged people. So some of climate change have been caused by, the current generation. But students, you are the young generation who are going to have this earth and this planet for your lifetime. So I hope you have some ideas on how we can cooperate and how we can help each other and to address climate change, which I'm going to speak with Mr. Johnson and in a few minutes later. So I want to put it like, we are moving towards to the next stage. Yep. So perhaps this is what I'm going to speak during the Q&A session. This is a very quick the actions and proposed by the UN. So what we can do in our daily life. So very quickly, save energy at home, and we use bike and public transport more than private transport, and eat more vegetable menus, and have more vegetables when you eat meals at home, and think about your travel, especially air travel. And we should reduce food waste, and also recycle, repair, and we try to use more renewable energy sources and electric vehicle. And we use our money wisely and to support environmentally sustainable businesses, and also speak up about climate change. So I don't think it's new to us, and we know everything. It's really about action, how we act on those points. Yeah, this is the end of my presentation. Thank you for your attention.
Thank you so much, Dr. Yoon. Those images couldn't be more different to this environment that we live in here in Seoul, in South Korea. And thank you for sharing your experiences with us here today. Really quite remarkable. I'd like to invite you to sit with me, and I'm going to start off by asking you a couple of questions, and then we're going to open it up to you to ask Dr. Yoon questions. I'm sure you have many questions about his experiences in the South Pacific. So, Dr. Yoon, seeing those images, as I say, they couldn't be more different to this environment that we have here in Seoul. And I can only imagine back when you made that move with your family, huge change for yourself, professionally, personally, for your family, for your kids. So if you could talk to maybe some of what were the biggest challenges for you and your family when you made that move? So from a sort of personal perspective, but then from a professional perspective, what were some of the challenges that you first encountered?
Sure. Thank you, Mr. Johnson. So, firstly, I want to highlight some challenges to my family. So, when we were discussing, when and where to move back to Asia, because my organization was advising me to move my main station from Fiji to somewhere. So we chose Manila, Philippines. But at that time, there was a nationwide the lockdown. So in July last year, and Philippines had closed all schools nearly 2 years. So I couldn't ask my family to join me, going to Philippines, because then my kids will be losing the education opportunity. So, and also my wife has a job in Korea. So we decided to live separately. I live in Manila, Philippines, and they live in Seoul, Korea. So that makes a lot of challenges in terms of family relationship and emotionally, because during the lockdown, I couldn't go out from my home in Manila. So I rely on the delivery service for my daily meals, and I couldn't have much time to go out for exercise. That makes a lot of kind of mental problems. So I think that was one of the biggest challenge in working in this international organization. And professionally, so because WHO and other UN agencies have different layers of organization. So like if I were in Fiji, then I can work very closely with ministry and field workers. But if I work with the region office or headquarters, so my job is more on desktop works, right? So it was a bit of change of my working style. So, but I think we are on a good track. So Ray and Lucy are studying well, and that they are playing with their students. So, and my family are doing well here. So I also work with my organization. So we are resilient.
Thank you, Dr. Yoon. Our young people here today, many of them, if not every single one of you here today, the thoughts will be crossing through your mind about what will I do when I graduate from Dulwich? What will my career be? Where will life take me? And I'm really interested to hear about what drove you to become a doctor, Dr. Yoon. Why did you make that choice?
Sure. Yeah. So to be honest, and when I was in high school, actually, I didn't have any chance to, attend this kind of international school when I was young. But my father was advising me to be a doctor, because it was just after financial crisis of Korea. So there's a biggest issue with job stability. So my parents' generation thought doctor, lawyer can be a good the good job or title. But as soon as I entered the medical school, I found that I didn't make my vision. So I didn't think seriously about what I'm going to do with my doctor title. So in the first and second year in my medical school, so I thought perhaps I need to spend more time to explore myself and what to do, or whether I should continue this career. So the reason I'm telling this kind of very frank story about myself with Dulwich College students is that because sometimes kids don't think their future so seriously. So because they have so much expectation from parents and surrounding people. So even if you get into good school and good career path, and if you are not determined and what to do next, then it becomes a problem. So I spent a bit of time and to find a way. So I joined the volunteer work to support homeless people, migrant workers, because after financial crisis, there's a high number of homeless people in Korea. So still you can find some people in the Seoul station. But there was a really spiking rate of homeless people. Then I thought perhaps public health is a good way or effective way to support many people in a short time. So that's why I chose public health as my career. So I think my idea and my career path is not ordinary. So because many of my classmates are working in the clinical setting, so they are clinical doctors, seeing the patients and then operation and treatments. But my job is more on public health. So I just wanted to share my story.
Well, thank you so much. That's a very powerful message. That in terms of making those choices, which often are really complex and difficult choices to make. And some, I can think back to my own experience of making a decision about career pathways and not knowing really until quite late what I wanted to be, and then in life that changes as well. Where you wanted to take it. So that's really interesting. If I could ask you one final question. There is so much here in your presentation today. If there is one key message that you would like our students to take away with them today, what is that message?
So perhaps, I can say sympathy and being connected with other people. So the reason why I'm mentioning this concept is that if we think we are Tuvaluans or we are people in Fiji or Kiribati, South Pacific Islands, why don't you take any action right now? So because we live in a very different setting. So I know in Korea, climate change is not a great interesting topic. So there are climate change activists, and there is a political party interested in climate change. But many times I feel that people in Korea don't feel it's an immediate risk to them or to us. So I think we need to have more sympathy about the situation or the environment that people in South Pacific, not only South Pacific actually, Caribbean region and Africa, they face biggest challenges coming from climate change in their daily life. So I think we need to understand that we are connected each other. So even if it's happening in South Pacific, it happens to us. So like, for example, coronavirus. Coronavirus happened, first outbreak happened in China, and then it spread it to other countries. And there's a saying that, virus doesn't care about national border. Climate change doesn't care about it because it comes to the planet. So we need to have a more sympathy about people in a very difficult situation due to climate change, because we can be them. Their situation can be our challenges in soon. Yeah.
Thank you so much. That's a powerful message. Absolutely. The individual relationship that we have with nature and the responsibilities that we have. I can think back to, of course, the coronavirus pandemic that we're still living through. Here we are sitting with masks, all still. And the flooding that we had back in August, the record levels of flooding that we had here in Korea. All right, so let's open to you for questions for Dr. Yoon.
Raise your hand, please. Say your name. Say your name.
Hello, I'm Michael Kim, and so basically COVID killed many people and made many people sick, but COVID also gave us some good effects in the world. So I wonder if COVID gave some good effects in the South Pacific.
Thank you, Michael. So I think that's a really great question. Yeah, as you observed, COVID pandemic made also opportunities. So in South Pacific And it's a shame that in South Pacific before COVID, there was no testing capability, and there's no capability to treat the intensive care unit patients. So it made an opportunity to draw much attention from developed country and to invest on the hospitals and then testing facilities in South Pacific Islands, because many South Pacific countries didn't have much money to buy testing kits or buying ventilators, which is to support the COVID patients. So it made an opportunity to invest on their health systems, and they were able to review the situation of what's happening with their patients and their quarantine capability. So I would say it made a big opportunity to provide more the resources to developing country. Yeah.
The students have a couple questions. Is Nathaniel Chang here?
My name is Nathaniel Jang. So I was wondering, how was it coping with COVID as a WHO officer?
So thank you, Nathaniel. So are you asking me about my personal challenge or the coping strategy as an organization? As an organization, thank you. So, perhaps I need to reserve one day to brief you about what happened with WHO's activity. So, but in short, WHO's activity, I think I can summarize into 3 ways. So the first thing is about how to reduce the number of patients by quarantine and the social protective measures. And the second thing is about how to treat well the patients. And the third thing is vaccination. So it wasn't easy because it's a biggest pandemic happened in last 100 years. So the last one was Spanish flu, happened back in 1918. So it really needed a global level action and to work with many countries, because there are a lot of stakeholders in vaccination policy, treating, giving the guidelines on treating COVID patients, etc. So I think there are some gaps. There were some gaps that we need to identify and to fill the gap. And now the WHO is leading a global level discussion and to make a pandemic treaty. Treaty means it's a promise. It's a promise between member states and what to do next. If we get another pandemic. So WHO is working on a pandemic treaty and to have more resources, to have access to more resources, and to prepare ourselves against next pandemic.
Yeah, I'm Aiden Lee. I have a question for you. When you were in school or college, did you consider WHO to be like your sole career path in life?
Yep. Thank you, Aiden. Yeah, actually, after spending some years in my medical school, so I was dreaming of becoming a WHO staff, because when you look at medical textbook, and there are so many references coming from WHO, so I thought WHO will be my next career path. So that's why I chose public health, and WHO works in a global level and the regional level. So I thought, it would be a good opportunity to work with many experts and coming from other countries and to support, people in mostly developing countries. So that's why I chose WHO. And Actually, WHO is not only agency working in global health sector. So you can find similar job with UNICEF and World Bank, also many national agencies like COICA, JICA, USAID, and China Aid and European Commissions. So perhaps you can find more similar job opportunity if you are interested in global international cooperation or global health. Yeah.
When you went, my name is Petra, and when you went to the different islands, were there different languages?
Yeah. Thank you, Petra. So, I don't have good talent in learning languages. So I only use English and to communicate with the local people. But fortunately, many South Pacific islands are using English as a official language, even though they have a local language.
My name is Martha Galvez. What were your biggest challenges living in Fiji?
Thank you, Martha. Yeah, well, I think there was no biggest challenge, but one of the challenge was food, because I really a Korean food lover. It's a Korean, but there are really few Korean restaurants. So I think there was an opportunity to grow my cooking skill and also my wife's cooking skill. So we used our home as a home kitchen. Yeah.
I am Cherry, and my question is that when you were in Philippines and you were away from your family, so how did you feel? I mean, the language is different and the food is also changed.
Well, so I think Manila, the capital of the Philippines, is a very global city. So the diversity of food and the restaurants is really wide. So I didn't find any challenges in food. So, but because I live separately from my family, so there was a challenge in strengthening my relationship with family. So having more calls and video conference with my family, that worked.
Hi, Emma Chamberlain. You mentioned about lots of these islands being at the front line. I just wondered if the world continues as it is and makes no changes, what are the projections for when these islands, such as Tuvalu, will be just uninhabitable?
Yep. So it's a bit sad story. So UN, there is a framework convention on climate change. So they meet annually. So last meeting happened in Egypt, Cairo. The global target of temperature rise is 1.5, but in order to put down to that level, and we need to have a very massive changes in our energy industry, motor industry, every single sector of our society. We need to change our lifestyles. So climate change experts are putting a bit pessimistic forecast that we may not be able to keep that level. So which means islands country like Tuvalu may be under water in next 50 years. So there is a contingency plan that Tuvalu government already made an agreement with many countries, surrounding countries like New Zealand, Australia, Fiji, that they will be leasing their lands, some lands of Australia, New Zealand, Fiji, to migrate their people. But I don't think it's been shared widely because it's a really sad story. So that we have to evacuate people of Tuvalu from their own territory to another countries. So now there's increasing awareness on climate change migrants. So indeed, there's an increasing number of people getting out from Tuvalu, Kiribati, not only for climate change issue, but also job issue, education opportunities. So I think everything is interconnected. Yeah.
I think we've got time for one more question. I think we have one here at the back, on the right.
Hello, my name is Eileen, and I wanted to ask, have you ever faced like a natural disaster while living in Fiji?
Did you experience any natural disasters while
sure.
living?
Yeah. So it happened in 2020. So in the middle of pandemic. So there was a grade 3 tropical cyclone came to my house, and it was a really strong tropical cyclone. So one of big tree in my garden was broken because of the wind speed, and there was also damage around my house. So tropical cyclone is a very the usual situation to Pacific Islanders because they get so many tropical cyclones passing through their territories. So everybody knows that how to prepare themselves against tropical cyclone and also flooding, which comes after. But there's an observation that they get more often tropical cyclones. So these days. Yeah, so it's also, I believe it's another effect of climate change.
Okay, one more question.
Yeah, I am again. In WHO, do you get any holidays on Saturday and Sunday?
Did you get any holiday time when you were
Sure. Yeah, perhaps, that's why I can spend some more time with my family. So there's a policy for annual leave so that I can come back to Korea for having time with my family. So if you choose WHO staff as a job, so don't worry about it. So you can have more time with family.
You will get some holiday, some time off. Okay, that's very good to know. Well, Dr. Yoon, thank you so much for coming today, presenting to us and sharing your experiences and insights with us today.